wonder what this thing is up here. I wonder if this will, no. Really should be able to be alphabetized. I don't know why they don't do that. Okay, here we are. This is a voting session of HGO, and we're going to start with the easy work of House Bill 810, and the sponsor has requested to be allowed to withdraw this bill. Would someone like to make a motion to allow that?
So move.
Second.
Any discussion? All those in favor say aye. All those opposed, please raise your hand in the panel. House Bill 810 is withdrawn. It will be withdrawn. Report. And it's unanimous. House Bill 288, Tyler.
House Bill 288 would enroll Maryland in the Interstate Compact for audiologists and speech pathologists. That is not yet enacted. So when the requisite 10 states have adopted the compact statute, then it would be enacted, and Maryland would be a founding member. There were two amendments of technical nature adopted in subcommittee, and the bill was voted unanimously.
Delegate Kelly.
Thank you, Madam Chairman. In the subcommittee, we worked to make sure that the otolaryngologist concern was addressed with the technical amendment. So they were fine with it. The board was fine with it, and the subcommittee supported it unanimously. So I need to move the amendments.
Second.
Is there any discussion on the amendment? All those in favor say aye. All those opposed,
Aye.
no. The ayes have it. Don't say no. Raise your hand. I'm sorry. It's hard to unlearn tricks. Is there a motion on the bill?
Move the bill as amended.
Second.
Is there discussion on the bill as amended? All those in favor say aye. All those opposed, no. Raise your hands in the panel. The bill passes unanimously. House Bill 317. Tyler?
That's being held for.
Oh, sorry. Right. I'm holding that bill. I'm holding a couple of bills because we want to look at a few things. Let's look at the next one. House Bill 368. Aaron.
This bill establishes the Task Force on Oral Health in Maryland. It's a 2-year task force staffed by the Maryland Department of Health. The task force will analyze current access and identify barriers to dental health services. There were amendments that were adopted in the Public Health Subcommittee. The amendments add a representative of the Maryland Rural Health Association and provide that one of the things the task force will study is the current access to dental health services for all residents of the state, with a focus on socioeconomic status, race, ethnicity, age, and disability.
Delegate Penny-Melnick.
Thank you, Chairman Pendergrass. The bill basically will bring input from all over Maryland. The goal is to have hearings conducted and get input. We discussed the amendment in the bill. We brought in the advocates and people from the dental community. There was some disagreement on who should chair the task force. Presently, the task force is being chaired by the Deputy Secretary of Public Health Services, or the Deputy Secretary designee, and the Dean of the University of Maryland School of Dentistry, or designee. They chose that so that it's not an advocacy group, in order to be neutral. After we discussed it, I moved the amendment that we just discussed, and the vote was unanimous, both on the amendment and the bill.
Want to move the amendment?
I moved the amendment.
Second.
Madam Chair.
Delegate Saab.
Thank you, Madam Chair. So the bill originally had a $40,000 a year fiscal note for 2022 and 32. Does the amendment change any of the fiscal note amount?
I don't believe the amendment changes the fiscal note. Am I right, Erin?
Correct. It does not change the fiscal note. There's still a note to staff.
And the bill passed as it did in the Senate, which was unanimous, with the exception of the amendment that I placed on the bill to include the rural areas.
Thank you. Thank you, Madam
My
Chairman.
pleasure.
Any other discussion? Have you moved the bill as amended? I
I
believe you
move the
have.
amendment. We have
Oh,
to take a vote on the amendment.
Thank you very much.
My pleasure.
All those in
Second.
favor of the amendment, okay, say aye. All those
Aye.
opposed, no. Please raise your hands. I see no hands in the panel. The amendment passes unanimously.
I move the bill as amended, Chairman.
Second.
Discussion on the bill is amended. I see no hands raised. All those in favor say aye. All those opposed, please raise a hand in the panel. I see no hands in the panel. This bill passes unanimously.
Thank you.
I held the next two bills. House Bill 1033, Lisa.
This bill requires the Office of Healthcare Quality during an annual inspection to monitor the compliance of each assisted living facility with the requirement to make available to all residents and employees educational and informational materials relating to immunizations for the flu and pneumonia. It was discussed in the Health, Occupations, and Long-Term Care Subcommittee, and there were no amendments.
Delegate Kelly.
Thank you, Madam Chairman. The subcommittee really liked this bill and it passed unanimously. Move the bill.
Second.
Any discussion on this bill? All those in favor say aye. All those opposed, no. Raise your hand. Seeing no hands, this bill passes unanimously. House Bill 1040, Lisa.
For House Bill 1040, everyone should have an amendment and also a reprint, since the amendments were a little bit complicated. So the bill authorizes a licensed pharmacist to administer a vaccine to a child if specified requirements are met during a specified period of time and establishes certain reporting requirements. The amendments strike language making the bill an emergency measure and retain current law for vaccinations, subject to the authorization for licensed pharmacists to administer vaccines to children ages 3 to 17 from July 1st, 2021 to June 30th, 2022. No,
3, I think.
2023, excuse me.
It should be 23.
The amendments specify requirements that must be met if a pharmacist administers a vaccine as authorized in the bill, including that the vaccine must be approved by the FDA and ordered and administered in accordance with CDC schedules, and that the pharmacist must have specified training, comply with specified record keeping and reporting requirements, and inform each child, patient, and adult caregiver of the importance of well-child visits. The amendments also require 2 reports. The first report is due on December 1st, 2021, and will include information from that the administration, and this is the Prevention and Health Promotion Administration of the Maryland Department of Health in consultation with the State Board of Pharmacy. They will conduct the study, and the first study will include information on what the administration determines is important for setting policies for authorizing pharmacists to administer vaccines to children, including the number of vaccines administered in accordance with the bill, the effectiveness and efficiency of Immunet, and the impact of well-child visits. The second report is due on December 1st, 2022, and will be more comprehensive. It will evaluate data from Maryland and other states on all children's vaccines and study the effectiveness of Immunet, including input from all healthcare providers that administer vaccines to children. The report will consider public health models in which pharmacists and chain and independent pharmacies work in partnerships with local health departments, pediatric primary care providers, and schools, and will address implementation recommendations, including tracking multi-dose vaccines, optimal physical space configurations, staffing requirements, and processes for responding to adverse reactions. The administration may use available funding to contract with a public health research institution to complete the report and is required to consult with interested stakeholders when completing the report. And those are the amendments you have in your packet. There is one additional just verbal amendment, and that is changing the title of the bill. And the new title will be Health Occupations Pharmacists, Administration of Children's Vaccines, Study and Temporary Authority.
Thank you. Delegate Kelly.
Thank you. And thank you to Lisa for reading all of those amendments. I think the committee can tell that everything about this bill has changed except for the bill number. We're looking at a really different bill with these amendments. I want to thank all of the subcommittee members who contributed their ideas to what we should be studying and looking at on this issue, and all of the stakeholders for working with us for really coming up with what we think is going to be a very balanced study that's going to have MDH giving us the information that we need to make thoughtful policy decisions. So what we did was we basically started with the OAG's letter suggesting that we narrow the scope to what is only the current federal order. So what is currently happening on the ground as a result of the federal order for pharmacists administering vaccines to children. So it's narrowed to that. It sunsets after 2 years, which is the timeline that we're also using for the telehealth process. And of course, the study that Lisa just read us the details of. So again, we want to take sort of the same path that we're taking as telehealth, acknowledge that the world has changed, take the opportunity to study that to get the information that we need to make policy decisions. We do have an interim report coming next session, and then a final report the following session with a sunset after that. This study is going to look at issues with Immunet. It's going to look at any changes in well child visits and how we can support and facilitate increasing well child visits. It's going to look at space, staffing, process for responding to adverse reactions, and hopefully give us the information we need to make a thoughtful policy choice. The vote in the subcommittee was 9-2. I would like to move the amendments.
Second.
Are there any questions or discussion? Seeing none, all those in favor, oh, you need to raise your hand in the panel. Terry, is that you trying to, Terry? If you're trying to talk to us, your hand is raised.
No, it's up in the panel. It's up in the panel. Sorry, it's not yellow, but it's up. Okay.
It's not in the panel. It's in the window. I'm not sure what that means, but that's fine. And then Delegate Chisholm.
Okay. So Delegate Kelly, so is this allowing immunizations down below the age of 9? I'm not really clear.
So all we're doing is basically putting into law temporarily the current federal order that's already in effect. So right now, the childhood immunizations from 3 and up are allowed at pharmacies as a result of the federal order that the Biden administration continued that was put in place from the Trump administration. So that's happening right now. Our expectation is that that will continue through, because childhood vaccinations have plummeted as a result of COVID. Our expectation is that that is going to continue through the back to school season, through the spring when children are being, the younger children are hopefully eligible for the COVID vaccine. So we don't have a timeline for when that federal order expires, but what we think we've done is set in place a system and a process that will allow us to respond. I think our expectation, which I think is reasonable, is that that federal order will continue through the time of this study. If it doesn't for some reason and we want to, halt, we're getting red flags and we want to halt, we do have that interim report next session so we can make that decision at that time. The federal order is not going to expire, this fall. It's been in place for more than 7 months now, and it's necessary, I think, from the federal policy perspective in the crisis we're in right now.
Okay, so the study is really looking at it, but without the part on page 3 that says that where the state says pharmacists may, the federal law would allow that to happen. So we don't necessarily have to. In other words, if we do page 3, I don't know what line, this is line 19, right, which says through 2023, regardless of what happens to the federal law, will allow the administration of the vaccine to continue. then we're really extending it beyond the federal law potentially, right?
There is in this bill the potential extension beyond the federal law. Not necessarily. We really don't know. We're sort of blind to what the feds are going to choose to do. We can only make our best prediction. So I just spelled out what I think our best prediction is. We know the COVID vaccine for younger children is not even going to be available until after January, first quarter of 2022 is what Dr. Fauci is saying. That being said, you're right that it does potentially allow for us to go beyond by a few months because of the timing of our legislative sessions. That was a policy choice that we made because we wanted to make sure that we had the ability to conduct the study in a not in a rush. We're not going to find out what we need, within the next 6 months, and really, have predictability for the study and for folks. So I think, basing it on the model that we used for telehealth, I think the committee felt like that was an appropriate, I don't want to call it a risk, that's the wrong word, but an appropriate policy choice to make to stick with that timeline, with the understanding that we have every ability to change that next January should there be any indication that we need to.
Okay, because my understanding from Ms. Locklear is that there really haven't been very many children, at least they don't have the data on since the federal went in between the ages of 3 and 9. There's not a lot of data of whether there have been kids who have been receiving their vaccines to the pharmacist. So it's not that we're continuing something that COVID started. The vaccinations that the pharmacists have been doing have primarily been in adults and the flu shot and things of that.
I mean, you're absolutely right. We have seen a huge decrease in childhood vaccinations, and that's why the federal order went into place, because there was a policy decision made at the federal level that we need all hands on deck to increase childhood immunizations, particularly, because we didn't have a regular back to school period this year. Unfortunately, kids have been home with virtual learning. A lot of those regular clinics that have been sort of filling the gap and taking care of kids who haven't been going to their well child visits or who don't have a primary care provider. A lot of those clinics didn't take place this year, and some counties even stopped them altogether. So there's this huge, if you look at the data on vaccination rates in Maryland and across the country, kids are falling way behind. So that's why that federal order was put in place. I think the goal from the federal government's perspective would to see those numbers be moving as we come out of the pandemic. And I certainly think that's Maryland's goal as well.
Right. So the June 30th, 2023 date, I mean, you said we don't know when did the federals put it into theirs? You said
no, there's no date. If there
months.
were, we could structure a study more, dovetailed with theirs, but we're operating blind.
But we can do the study without line C, right? We could just say, we're going to go ahead and do a study for as long as the feds are allowing us to be vaccinating these kids, right?
I mean, one could do that. That was not the approach the subcommittee took, because we thought very carefully about the timeline and we realized that this would be the best way for us to get the information that we're looking for.
Okay, and did you all discuss also how the vaccinations may be impacted by the, the January or February final rule from the vaccine court, that they will not be covering the incidence of shoulder, the shoulder injuries from injections will no longer be considered covered under the vaccine court?
I'm not sure that that's relevant to this issue. So we didn't discuss that particularly. We certainly can.
Well, it changes the liability when if there's a concern about the liability and the difference in what the pediatricians and the nurses, their risk in injury to children in their shoulders versus the pharmacists, it does change. And I understand that the pharmacists are going to look back at whether they have to adjust certain trainings or what have you. So it may be that ruling will also mean that that this is not going to be the way to increase the vaccinators to.
Well, but we don't know, right? We don't know right now what's happening, which is why, I mean, if you look at the questions that this study is asking, it's really basic questions, right? What does an appropriate space look like? How does one deal with adverse reactions? We don't have any guidance from MDH right now. And that's happening right now in Maryland. So, it's a simple study in many ways. It's information that we should have. The study of Immunet You know, like these are questions that should be answered.
100% agree. The study is I think the study's appropriate and important. My only issue was about really the extension potentially well beyond the federal law that we will be allowing the vaccinations to continue down to 3. But I've asked, and you said that that's just what you guys thought would be right. I'm not sure I see the connection between that and telehealth at all. Kids aren't little grown people, and this is a very different kind of thing with a whole lot of different implications. So I love the study, was just really confused about this timeline from July 1st, 2021 to June 30th, 2023. And that's why I was asking about what the discussion had been, okay?
Yeah, I'm not sure if Lisa has anything she wants to add on the timeline. We did discuss the timeline extensively, and we really wanted to make sure that we were coming up with a timeline that would work for the legislature and work for our ability to get information from the study that is really going to be useful to us. So that was a large part.
Right. I mean, because you can do a much shorter one if the information you're trying to get is that. So it could have been tailored to fall within, a year or even less and get the same information. By doing it 2 years, it really seems, at least it appears like it's more about establishing a footprint.
I don't think it's about establishing a footprint.
Okay.
I really think it's about, us getting away from the immediate crisis that we're in right now so that we can, studying anything this month is not, everything is out of whack. Unfortunately, we're still working our way out from the crisis of the pandemic, and that's not data. I mean, if we're talking about looking at reductions in well child visits, that, it would be completely unfair to look to base that data point on, a year ago to today, because that was the entire duration of the COVID pandemic, right? So we know well child visits are down regardless of pharmacy access to vaccines.
Thank you. Thank you, Madam Chair.
You're very welcome. And so it was my error to not see hands. I was not looking at the top of my list, so I apologize. I have Delegate Chisholm next, followed by Delegate Krebs.
Thank you, Madam Chair. It's been my goal this year to kind of break things down to a 6th grade level, probably because it was my best academic year, but now I'm more, I guess my quick question is, it's just a study. Am I correct on that, Delegate Kelly?
Yes, with the exception of the conversation Delegate Hill and I just had. So in order to do the study, we're putting into the law the existing federal order, but we're not changing access on the ground. We're just temporarily for 2 years putting that authority into Maryland law and then sunsetting it.
So not changing any federal law, but maybe altering Maryland state law. Am I correct on that?
Correct. Yes.
Okay.
So that otherwise it's just a study to get us at this committee has had many questions about this issue. So we're just trying to answer everyone's questions.
Because it's changed quite a bit since its first drafting.
Yes, tremendously.
Okay. That's all I wanted to find. Okay. Thank you so much.
Absolutely. Thank you.
Okay, next I have Delegate Krebs, followed by Delegate Bandari.
Thank you, Madam Chair. I know we had talked about parental authorization, that there had to be parental authorization for everyone under 18, but I didn't see it actually in this part of the language. Where is it? Is it in the CDC language, or where can we find that to say that, yes, there has to be parental permission to get these vaccines?
The parental consent is required. That is existing law. Lisa, do you know where we can point to that?
I mean, is it a state law? Is it a CDC law? I just want to be able to say, yes, here it is.
I'm not sure exactly where it is. I mean, the vaccine is required to be administered and as ordered and administered in accordance with the Center for Disease Control and Prevention schedule.
It's not the schedule, it's the actual.
We can find that for you, Delegate Krebs. It certainly is in the existing.
No, and we've talked about it. I just didn't see it here. I'd like to be able to point to it and say, yes, this is where it is. And the question on the timeline, I mean, I'm on the subcommittee, and I think the question on the timeline right now, it seems like the Department of Health is swamped. So we're starting this in July 1st this summer. So they have some time. And if we had this thing back to us by next year, I don't think we'd have, as you said, I don't think we'd have good information. And in order to make it the next time we meet again, I mean, it almost had, that's the way the timeline fell out. That's the way we came up with it. I don't know if you change that. I think some of the advocates said they wanted to make sure that we didn't have a law that you stopped it and then you started it again, because then you'd have it for 2 years and then it would stop for 6 months if we reauthorized it. It would be confusing to the constituent. I think that's what the conversation was. Confusion on stopping it, starting it, and whatever.
Absolutely. Yeah, we did have that conversation. Lisa, did you have something you wanted to add?
I was just gonna say, I will double check on that for you, Delegate Krebs, but I have a feeling this is more of a general, just for medical procedures with children that.
And I'd just like, I think it'd be nice to know that, be able to confirm it and say.
But I don't think it's specific to vaccines. It's probably.
I think that any childhood medical care requires the parental consent, and the process on the ground in the pharmacies is that they be there and sign for it.
Well, I think there are a few
And that this
exceptions
won't
to
change
that.
that. Yeah.
I think there's a few exceptions to that are a little bit more political, that I think there are some exceptions. So I don't,
Yes, vaccine administration is not one. I can assure you
Yes,
of that.
that-
So we will
that's what I
we'll
want.
find that part of the code for you.
make sure of that. Okay, thanks.
Thank you.
Okay, where am I on the list? Delegate Banderi, followed by Delegate Johnson.
Well, thank you, Madam Chair. First of all, I would like to thank you, Delegate Kelly, for a wonderful job. Our subcommittee went through each line, and there were a couple of concern: privacy, safety, and adverse reaction. And with the opposition panel, and we drafted the amendment, including everybody. And I would like to make sure, based on my understanding, that this bill could be a well child, like it does not replace any well child visit, and it could be access point to the child visit. And vaccination visit are not the doctor's visit. It is all about the access. Thank you, Delegate Kelly.
Absolutely, Delegate Bandari. That was one of the main parts of our discussion, was making sure that we would move forward in order to get some recommendations from the Department of Health that will help us figure out ways we can increase well child visits and certainly not decrease them. So we want everybody to be working together on the same page towards that goal.
Delegate Johnson, followed by Delegate Saab, followed by Delegate Riley, and that's my list.
Thank you, Madam Chair. And I was going to ask, is this pharmacist shall or pharmacist may? Because a lot of pharmacists don't even get flu shots because they don't have the room, or they just are not good at giving shots. So
Absolutely. It's entirely voluntary, Delegate.
So
Johnson.
it's may, it's not shall.
Absolutely.
All right,
And that's
thank you.
part of again, we just codified the federal policy. So
Okay.
they're not required to now, they won't be tomorrow.
Great, thank you. Thank you, Madam Chair.
Absolutely.
Delegate Saab.
Thank you, Madam Chairman. Just wanted to clarify, I know I was on the subcommittee, but we talked a lot about it yesterday, and I just want to make sure that there's two things that I still understand in the bill that is correct. Does this, number one, does this include all vaccines, or is it just COVID? And the other question is that if the federal government ends the emergency order next month, does the study continue, but the administering of the vaccine stop? Would the study continue?
Thank you for those questions. So as I explained to Delegate Hill and Delegate Chisholm, what we're doing is putting the federal order into state law for the 2-year period. So if for some reason that federal order were to end in January, for example, that this would continue unless the legislature took action. But we do have the ability to take action. We have an interim report coming, so we can certainly make that choice. Our best guess is that the federal order isn't going anywhere because we're looking at the childhood vaccination rates, which are incredibly low. To answer your first question, this bill covers both the COVID vaccine and the regularly scheduled childhood immunizations, which the children in Maryland are falling behind significantly. The data point that we had was for children who are enrolled in Medicaid, 40% of those children did not go to their well child visits last year, which means that they fell behind in their childhood vaccines. And as I mentioned earlier, of course, we know that the childhood vaccination clinics that are run by the health departments really slowed down this year. And in some cases, 2 counties stopped them altogether. So those vaccines, we need to get Maryland kids up to pace with their vaccines, certainly before they go back into in-person school next year.
So if the emergency order ends, pharmacists continue to be able to do vaccination for the next 2 years unless if we took action?
Exactly. We would need to take action to stop that. And that's to give us the predictability that we need to do the study, and to the consumer point that Delegate Krebs made. That being said, though, if we're seeing any red flags or anything on the ground happening this fall, we will have that interim report and recommendations from the Department of Health. And I'm sure they would not hesitate to recommend, if they're seeing anything bad happening that we need to address, to recommend that we stop the study, which is a choice that we could certainly make.
Thank you. Thank you, Madam Chairman.
You're welcome. We've got another bite at the apple there. Delegate Saab, then Delegate Rose. Sorry, I thought it was hands are changing. Sorry
I took
about
my
that.
hand down. Thank you, Madam Chair.
Yes,
My question
okay,
was
Delegate
answered.
Riley.
Thank
Okay,
you.
good. Delegate Rosenberg, your hand has popped up, so you'll be the last question.
Okay. Is there any way for us legally to, if we want to take action before we're back in session, to affect this, or we don't want to do that? I'm thinking out loud. I don't know.
I mean, let me tell you what we do know about the timeline. This is March. The COVID vaccine for children 12 to 18 is not going to be approved until the fall. So there is going to be extraordinary demand for parents like me who have teenagers to get that vaccine. So this will be in effect, I guarantee you, through the fall. And then children 6 to 12, it's expected to be approved sometime in the first quarter of 2022 when we're back in session.
Thank you.
Sure.
Delegate Hill, you need to unmute.
Thank you. So again, we've got this 2-year thing, as you said. There's nothing that's going on here that changes the fact that in Maryland, pharmacists can vaccinate down to the age of 9. This bill's not changing that. It will go on past COVID and all that. This is really about the 3 to 9-year-olds that the studies, as you point out, are not even going to be. So we're not talking about the COVID vaccine for this group. We're really talking about the childhood immunizations. The information that we have from the pediatric community, including the nurse practitioners, is that as schools have reopened, the parents are going back to get those shots. So, and we're not hearing from them that they're having problems meeting those dates to get those kids vaccinated as they re-enter school. So you're correct that at the beginning, they were missing those dates, but they also weren't around other kids and they weren't entering school. So I guess I'm asking, what is the problem with making this a 1-year instead of a 2-year, extension for the 3 to 9-year-olds?
It's an interesting question that you ask, and I thought about this as well. I do think, though, we have to recognize that the COVID vaccine is going to be 6 to 12-year-olds are going to be eligible for the COVID vaccine. Hopefully, parents of younger children are hopeful for this in that first quarter of 2022. And I find it not likely that our childhood immunization rates are going to go up just because people are going back now and catching up with their well child appointments. We're not seeing any data that shows that kids are back to their fully vaccinated status right now at all. We're seeing the opposite. So I know that people are beginning to go back to their appointments, but there is a huge backlog, and there are lots of people. I'll say it again, 40% of the kids in Medicaid didn't make it to their appointment. That data is from March. So that includes people who went back in January, February, and March.
Okay, not to be, again, the 2 years seems like a long time. The 3 to 9-year-olds are what we're talking about, and they shouldn't be confused and mixed up with the 9 to 12-year-olds and so forth, because they're 2 different groups. The risks are totally different, and it just seems like extending, even if it said that it would extend for 2 months beyond or 3 months beyond for at least a year study is for the things that the study is trying to find out. All of those things can be, pretty well determined in less than a 2-year time frame. So I think you know, that.
Do you think that the Department of
It's a
Health
great
is
amendment.
capable of focusing on that right now in the middle of this COVID crisis? You're suggesting that they can do everything that we're asking for and give us
Well, then that
adequate
would,
answers.
sorry, that would be an issue, then delay the study, right? And you don't have to extend the time. Again, we're mixing apples and oranges. There's 3 to 9 year olds, and how long beyond the federal mandate we're going to be allow them to be the beta test group while we're conducting the study versus the study itself.
Let me interrupt here. Let me get in front of Delegate Kelly, and I apologize, but I feel a need to do this because we're kind of going around in circles. I thought very hard about timeframes because I think about those things. And this goes into effect, and the rest of the year, it certainly will be a federal mandate. I cannot believe, not a mandate, but a law to allow pharmacists to give these vaccines. I absolutely can't believe that it will end before January of 2022. I suspect it won't end then either, but I don't know that. I think it's very important to have this ongoing for 2 reasons. One is the study. We'd like the data that's more than 6 months of data, which is about what this will end up being by the end of the year when they get to look at it, because the year will have started. And maybe they'll look back, but I still think that it will, you know, at a minimum be a year. Well, I don't think it can be a year because it doesn't start until, when does this go into effect, Delegate Kelly?
I think we're talking June. Is that right, Lisa?
It's
Okay,
July
so-
1st, but yeah.
Okay, so it begins. In January, we're going to get an interim report, which won't be great data because it will be somewhat rushed because the health department still hasn't made a plan for COVID distribution and still doesn't have a single sign-up portal for COVID vaccination. And so they are working on the crisis at the moment, and other things are taking a back seat. Or maybe they're not working on the crisis situation. I don't really know, since I don't see a lot of progress. However, that said, we want to be reasonable in our expectations. In January, you can put a bill in that ends this. You can put a bill in and you'll have some data to base it on. Anybody can put a bill in to end this. And in which case, it could be an emergency, it could be something that goes into effect in July of next year. So there is a safety valve, which I thought was very important in this bill. On the other hand, we have a lot of children who haven't gotten their vaccines, and probably parents who are uncomfortable going to get these kinds of things right now in COVID because most parents haven't been vaccinated and in terms of COVID. So they may not feel comfortable having to go into a doctor's office, a pharmacy, or anywhere else to get their children vaccinated. And that is a real public health issue. That is almost a crisis, and it may be a crisis by next year. So what this does is it says that parents will have some time to catch up for their children. And hopefully the Department of Health might even do something about encouraging people to see their doctors, go to their pharmacy, go to the health department, and catch up on this thing that is getting left behind while we're dealing with this urgent crisis of COVID. So I'm very comfortable with the timeframes that the subcommittee came up with, and I'm very grateful for all the work that the subcommittee did. And I know that there is an emergency valve in there. If we see something untoward happening, it can be addressed in January. So with that, I'll hand the floor back to Delegate Hill. Are you still there?
That answers my questions. Thank you. That it gives an explanation for why that's the time frame for the extension of the 3 to 9 year olds in pharmacies. Thank you.
You're very welcome. It was explained to me by the chair of the subcommittee. I'm grateful to have such able people on my committees, all of them, who do their homework and then take the time to make sure that I understand what's going on when a bill is going to the House chamber. So thank you, Delegate Kelly, for that. Is there any other discussion of this bill? I see Delegate Saab's hand is up again. Did you have another question?
I did, Madam Chairman. And so initially when the bill came in, obviously I wasn't okay with it. When I talked to Delegate Kelly, she said it's a study, and I was starting to be okay with it. What I'm not okay with is the safety valve that you just talked about. And I'd like to have the safety valve, and I think I'd like to switch it around. Instead of we have to come back to extend it, and to end it, we have to come back to extend it, which is the same thing, because just the same way we can put a bill in next year to stop it, we can also put a bill in to extend it, because the federal government can end this at any time. And also, what worries me about this particular study or bill, because we're doing it, that it's just not only vaccine for COVID, it includes all vaccines. So I guess my question or my request is to possibly, I know it's out of subcommittee, but to put an amendment to have it stop when the federal order stops, and then study it from them, because we're still going to have at least a year and a half to study. It's not like we're going to not have data. However, though, one of the concerns that we had yesterday in subcommittee was that Immunet is not perfect. There's a lot of issues with Immunet, with a lot of reporting. And I think in theory, it sounds good that we're going to have all the data, but we're not going to have all the data that we need. So I guess my request is if I can hold the bill to add an amendment to switch the dates. To us, we have to come back next year and extend it in the event that the federal order is discontinued.
Delegate Kelly, when is your subcommittee meeting next? Do you know?
We meet on Thursday.
Okay, I think that's a little late. But I want to honor the request to hold a bill, as I try to do. You can hold it till the next voting session. You get that amendment drafted, and we will take it up as a committee, as a voting session at the next voting session, which I think now is going to be tomorrow. We will schedule a voting session for tomorrow. What does our schedule look like? I'm guessing Melissa has the best picture of when the subcommittees meet. Do you post that stuff, or do the staff? So what does tomorrow look like in terms of subcommittees? Knowing we're having 2 floor sessions, of course.
Yeah, we're supposed to have government ops meeting in the morning, like usual.
Okay. Well, at some point.
And if I may, we're also going to have public health, a meeting somewhere in between.
Insurance needs to meet too. It seems like everybody needs to meet.
Okay. All right. That's what I needed to hear. We will have another voting session tomorrow. I'm not sure when it will be. It will likely be late in the day, because I want to give everybody a chance to get their subcommittees done. It means some new things may come from the subcommittee and get put on the vote list. I don't know. Some old things may get put on the vote list, and certainly this bill will get put on the vote list. So I just want to give you fair warning that this is what we're going to do tomorrow. It's going to be a very long day with 2 sessions, all the subcommittees meeting and a voting session, but it's that time of year. And I know you guys are warriors, and we'll get through this, okay?
Thank you, Madam Chairman.
You're very welcome, Delegate Saab. Get a good night's sleep, everybody, because of what a long day it's going to be tomorrow. Okay, with that, we're going to hold this bill, and we're going to move to, let me find my sheet. Looks like we're almost done. House Bill 1127. Aaron.
This bill decreases from 15 to 9 the total number of members of the Garrett County Memorial Hospital Board of Governors. The bill also modifies the terms of office of at-large members and reduces the number of required annual board meetings. This bill was in Government Operations and Health Facilities.
Delegate Rosenberg.
Yes, this is a delegation bill. There is a cross-file, not controversial. Cross-file is moved off of second reader in the Senate. So it was a unanimous support favorable in subcommittee, and we would move favorable for the full.
Second. Move the bill.
Discussion. All those in favor say aye. All those opposed, no. Please raise your hands. I see no hands. The bill passes unanimously. House Bill 1287. Lisa?
This bill expressly permits an individual to use telehealth when practicing clinical alcohol and drug counseling without a license or alcohol and drug counseling without certification if the individual is working as a trainee under supervision while fulfilling experiential or course of study requirements. There were no amendments.
Delegate Kelly, we've had a
Yes,
busy week.
Yes, the subcommittee liked this bill, although maybe they have amendments now. I don't know. They voted unanimously. Move the bill.
Okay.
Second.
Is there any, thank you. Is there any discussion on this bill? All those in favor say aye. All those opposed, no. Please raise your hand in the panel. Seeing no hands, this bill passes unanimously. Okay, good work, everyone. The product will be better. Products will be better for the work that you all did this week and in future. I need you to keep up your strength. Ice cream for breakfast, my recommendation. Delegate Barron, good job on the floor today. And with that, also Delegate Kelly, of course, great job on the floor today. With that, I'll see you all tomorrow on the floor at 10 a.m.